Welcome to MedMadness, where we break down complex medical topics into clear, concise, and understandable content. In today's episode, we'll be discussing oppositional defiant disorder, commonly known as ODD. This condition is often seen in children and adolescents and is characterized by a pattern of defiant, disobedient, and hostile behavior toward authority figures. Understanding ODD is crucial for clinicians, educators, and parents, as early recognition and intervention can significantly improve outcomes for affected individuals. Oppositional defiant disorder is more than just occasional temper tantrums or rebellious behavior. To diagnose ODD, the pattern of behavior must be persistent, lasting for at least 6 months, and must occur with people other than just siblings. Next, let's discuss the diagnostic criteria for oppositional defiant disorder. ODD is diagnosed based on a pattern of behavior that includes an angry or irritable mood, argumentative or defiant behavior, and vindictiveness. This can manifest in various ways, such as frequently arguing with adults, refusing to follow rules, deliberately annoying others, or blaming others for one's mistakes. It's important to note that these behaviors must be excessive compared to what is developmentally appropriate for the child's age. Next, when diagnosing ODD, it's essential to differentiate it from other conditions that may present with similar behaviors. For example, conduct disorder involves more severe violations of societal norms and the rights of others, such as physical aggression or cruelty toward animals. Additionally, bipolar disorder includes distinct episodes of mania or depression, which are not characteristic of ODD. Intermittent explosive disorder involves sudden outbursts of aggression, whereas ODD features a more generalized pattern of defiance and irritability. Now let's consider a real-life example. Sarah, a 9-year-old girl, has been increasingly defiant at home and school. She frequently argues with her parents and teachers, refuses to complete her homework, and often blames her classmates when things go wrong. Her parents initially thought this was just a phase, but after several months, they noticed that her behavior was impacting her academic performance and social relationships. After consulting with a child psychologist, Sarah was diagnosed with oppositional defiant disorder, with a structured treatment plan that included parent management training and individual therapy for Sarah. Her behavior gradually improved, and her relationships with her parents and peers became more positive. Next, the treatment for ODD primarily involves behavioral interventions. Parent management training is crucial, as it equips parents with strategies to reinforce positive behavior and manage defiance effectively. Individual or group therapy focusing on anger management, problem solving, and social skills can also be beneficial. While there is no specific medication for ODD, it's important to assess for and treat any comorbid conditions like ADHD. To summarize, oppositional defiant disorder is a behavioral condition characterized by a persistent pattern of defiant, disobedient, and hostile behavior toward authority figures. Early diagnosis and appropriate intervention are key to helping children like Sarah manage their symptoms and improve their quality of life. For those preparing for exams like the USMLE, remember to review the diagnostic criteria, differential diagnosis, and management strategies for ODD. Thank you for listening to MedMadness. Don't forget to engage with our pre- and post-podcast quizzes and Anki flashcards for a more effective study experience. Stay tuned for our next episode, where we'll continue to make complex medical topics easy to understand.